Do you often feel stiffness in your neck or shoulders? Or lately, do you find yourself forgetting things more often, saying, "Wait, what was that again? Hold on a second. What I am about to tell you could change your life." I am Dr. David Jung, a physician who has treated stroke and brain vessel patients in the ER and neurology clinics for decades. Today, I want to share one of the most heartbreaking moments from my practice. It was a man, perfectly fine until the evening. He laughed with his family and watched TV, but on the way out of the bathroom, he suddenly collapsed. One side of his mouth drooped. His speech became slurred. By the time he arrived, the golden treatment window was already closing. Why am I telling you this? Because it happens every day. Patients often say, "But he was fine just yesterday." Look in the mirror. When you smile, are both corners of your mouth even? Raise both arms. Are they at the same height? If speech suddenly becomes unclear, or you feel the worst headache of your life, those are warning signs. Our blood vessels age faster than we do. You may be 50 on the outside, but your arteries may already be 70. Brain vessels are as thin as hair strands. Even a small blockage is dangerous. The brain may be light in weight, but it consumes enormous amounts of blood and oxygen. Even a short blockage can have devastating consequences. But here is the good news. Brain vessels have remarkable recovery potential. Sometimes new bypass pathways form around damaged areas. But it depends on one condition: your lifestyle and food choices. So today I will give you 3 things. Why brain vessels become blocked. 3 foods you can use daily to protect your brain. A simple daily routine you can start right away. And at the end, I will tell you the danger signals and when to go to the hospital immediately. Why do arteries get blocked? Active oxygen and inflammation damage the vessel walls. Bad cholesterol sticks to those tiny wounds. Quietly, the arteries narrow. It happens in stages. Stage 1, silent inflammation, no symptoms, easy to miss. Stage 2, warning signs, dizziness, headaches, poor focus, shortness of breath, often ignored. Stage 3, acute stage, slurred speech, weakness in arms or legs, facial drooping. By then, it may already be too late. That is why prevention is crucial, and it starts with what is on your plate. I call these 3 foods the brain vessel trio. Dark grapes and berries. Grapes, blueberries, strawberries, raspberries. The purple and red colors come from anthocyanins. Grape skins contain resveratrol. Together, they are powerful antioxidants. They protect vessel walls from oxidative damage and help maintain elasticity of blood flow. How to eat. Eat grapes with the skin. A handful of berries is enough. Frozen berries are fine. Nutrients remain intact. Top them on plain yogurt for gut health. Caution: if you are on blood thinners, do not suddenly change your intake. Keep it steady and check with your doctor. Mulberries. Mulberries are the dark fruit of the mulberry tree. The darker the color, the stronger the antioxidant effect. They help calm vessel irritation and reduce the risk of clots by preventing platelets from clumping. How to eat. Freeze them first. Freezing breaks down the cell walls and releases nutrients. Half a small cup is enough. Too much may upset your stomach. Tomatoes. The red pigment in tomatoes is lycopene. Lycopene protects vessel walls from oxidative stress and prevents platelets from sticking together. Cooking boosts lycopene absorption. Olive oil enhances it further. How to eat. 1 medium tomato a day. Better cooked, like tomato sauce, stew, or stir-fried with eggs. If you have kidney disease and need potassium restriction, consult your doctor. The brain vessel trio summary. Dark grapes and berries. Mulberries. Tomatoes with olive oil. But remember, what you pair them with matters. Avoid sugary desserts or syrups. Blood sugar spikes hide the benefits. Avoid high caffeine drinks at the same time. They stress weak hearts. Consistency is key. If you take medication, always check with your doctor before adding new foods. A simple daily routine. Morning, wake up with 1 or 2 glasses of water. Plain yogurt with a handful of berries. If too sour, add a touch of honey. Avoid strong coffee at the same time. Space it out. Lunch. Keep portions reasonable. Add tomatoes to your salad or side dish. Cooked tomatoes are even better. 1 spoonful of olive oil is enough. Afternoon snack. Half a small cup of frozen mulberries. Let them thaw slightly. Do not oversweeten. Evening. Walk for 30 minutes, just brisk enough to talk. Shower, stretch, and aim to sleep before 11. Sleep is the best vascular therapy. Storage tips. Freeze berries and mulberries unwashed in airtight containers. Wash only right before eating. Store grapes with skins intact. Eat them quickly. Ripen tomatoes at room temperature, then refrigerate. Overripe ones, make sauce. Self-check. Climb 3 flights of stairs. If you are unusually breathless or heavy-chested, get tested. Keep a diary of dizziness, numbness, or tingling. Tell your doctor. Go to the hospital immediately if you suddenly feel weakness in one arm or leg, sudden slurred speech, the worst headache of your life, or one side of the face droops. Do not hesitate. Call emergency services. Is it too late to start now? Never. In just 3 months, your body responds. Less fatigue, deeper sleep, sharper thinking, improved blood pressure, blood sugar, and cholesterol numbers. Key takeaways. The brain vessel trio. Dark grapes and berries, a handful daily, frozen is fine. Mulberries, half a small cup, frozen preferred. Tomatoes, 1 a day, cooked with olive oil. Avoid. Sugary desserts with berries. High caffeine drinks at the same time. Irregular or excessive intake if on medication. Lifestyle rules. Start mornings with water and light movement. Walk 30 minutes daily. Sleep before 11. Reduce stress, increase conversation and hobbies. Your action plan. Tonight, add these to your basket. 1 pack of grapes or berries, a bag of frozen mulberries, a few ripe tomatoes, and a cup of plain yogurt for tomorrow morning. Look in the mirror and say, starting today, I am making my blood vessels younger. Small repeated steps change your life. If this video helped, please like, subscribe, and turn on notifications. Share it with family and neighbors. Your small action today can protect tomorrow for you and your loved ones. Thank you for watching. I am Dr. David Jung. Let us protect your brain health starting today.